Hi and welcome back all of you for the next lecture on epidemiology, and what we're going to study here is the concept of association and causation. Now many students, when it comes to association and causation, when you see it in your MCQ books, you worry what exactly it is. So first you have to understand it comes under epidemiology, and in epidemiology what we're doing, we are connecting the cause with the disease. Okay, we have to find out the cause for a disease, or I would say the association of the cause with the disease. Okay, that is what the concept of association and causation is. Okay, the association between cause and disease, that's what we are going to study, and that's what epidemiology is all about. So let us see what it is. So initially, just a recap. Descriptive study means what? It is to identify the disease problem or identify a disease in a community, in a population. Okay, identify, that's it. That's what descriptive study do, or describe a disease. That's it in simple terms. It just identifies or describes a disease. Now, what next? And this helps in suggesting a hypothesis. That's it. Describe a disease or identify a disease and suggest a etiological hypothesis. Now, what next? Analytical studied and experimental study. What does it do? It helps in testing this hypothesis. We are doing what? You are doing case control study, cohort study, or that's what analytical study is, and you are conducting experiments or experimental studies, and this helps in testing the hypothesis, isn't it? This helps in the testing of hypothesis. Plus, what it does is it confirms or refutes. Okay, it confirms or refutes the observed association between the cause and disease. Okay, between the cause and the disease. So, descriptive study just describes a disease and helps to find out a hypothesis that this disease is connected. Possibly, this is the disease connected with this. That's hypothesis. Now, analytical study tests the hypothesis. Okay, and it confirms, by testing the hypothesis, it confirms or refutes the association between the cause and the disease. Okay, that's what we're going to study, how it's going to happen. Now, if you define the term association, we'll come to know that it's a concurrence of two variables. Okay, it's a concurrence of two variables. I'll come to what concurrence is. A concurrence of two variables more often than would be expected. Okay, that is, concurrence means both of them occurring together. That is two variables, okay, occurring together. For example, smoking and oral cancer or lung cancer. Smoking and lung cancer, both of them always occurring together. Concurrence of two or more variables. Two variables or more. In this case, two. That is, one variable is smoking, one other variable is cancer. So, concurrence, that is occurrence of two or more variables, often than would be expected by chance. That means smoking and lung cancer, if once you see the connection, you say that it's by chance. If it's seen again, okay, probably by chance. See again the association, again. That means now you say that, okay, it's not by chance, there's some association between that. That's what the concurrence, that is occurrence at the same time of two variables more often than would be expected by chance. That's what is association. Okay. Now, association does not always imply a causal relationship. We'll come to that. Okay. An association doesn't always say that it is causative agent. For example, all those patients having cardiac disease sleep late at night. Just simply, you just make a study late at night, or they or they sleep more at night. Let us see. So you see between that cardiac disease and sleeping more at night association, but does it always imply it's a causative agent? No, that's what association does not necessarily imply a causative relationship always. No, there is another thing, correlation coefficient. We studied again this. It indicates the degree of association. Okay, so what is association we studied? Now, how much is the degree? How much is the degree of association? How highly it is associated or how lowly it is associated. Okay, degree of association between two variables or two characteristics. Okay, now it can be, correlation coefficient can be +1 or -1. What does it mean? +1 means it is directly correlated. That is, when this agent increases, when smoking increases, chances of lung cancer increases, isn't it? That's what. Now, on the other hand, when vitamin deficiency is there, that is when vitamin decreases, The chances of, for example, vitamin D is associated with diabetes mellitus in some like recent studies. So vitamin D decreases the chances of disease, the diabetes mellitus increases. That means it's a negative correlation. So +1 means both increases together, -1 means one decreases, the other increases. That's the correlation coefficient -1 +1. Again, correlation coefficient again does not imply causation. Does not always imply causation. Again, so that means association does not always imply causation. Correlation also doesn't always imply causation. Okay, that's simple. But what is more important here? Okay, all these were just an introduction. You don't even learn it, no problem. Basically, what we want to know here is, the key is association between the cause and the disease is what we are going to study, or what we are going to connect today. Okay, association between, so how you can associate a disease with its cause, or what are the types of associations which you can see. Okay. Now let us come on to the actual topic of importance today, that is types of association. There are three major types of association. One is spurious association. Okay, spurious association, I'll come to one by one. Then there is an indirect association. Okay, and there is a direct or causal association. Okay, causal association. So the three, that is spurious, indirect, direct. Direct also known as causal. Okay, so now this direct association can be again divided into one-to-one. So direct association is nothing but causal association. So it can be one-to-one causal or multifactorial causal. Just write it down there and explain them one by one. Okay, now what is the association you are looking into? What is association between disease and its suspected cause factor? That is the association we are looking into. All these will study based on this, that association between the disease and the suspected causative factors. So the first association we are going to see is spurious association, as I told you. So what is basically spurious association? That is observed association between what? Between the cause and disease. The observed association is not real. We know that it is not real. That is what is spurious association. That means the association where none actually exists. There is an association but it doesn't exist. Okay, I'll come to the example, it will become much more clear. That is, if they ask you an association where there is no real correlation or no real association actually exists, that is called spurious association. Now that is perinatal mortality, that is death of the mothers, okay, after giving birth to the child. In that case, we're going to study two cases, okay, where perinatal mortality in hospital birth and perinatal mortality in home birth. So how much is studying that in home birth, the birth which is given at home, how much is the perinatal mortality, and in hospital how much it is. And when a study was conducted, it was noticed that 27.8 people who gave birth at hospital per thousand out of 1,000, 27.8 people died in hospital. Okay, whereas in home the same 1,000 was checked and only 5.4. So what is your inference now? It's better to give birth in home than in hospital. That is what it is. But is there a correlation? In fact, exists? Do you think so? No chance. Okay, no chance. Okay, bye. I'll come to that. That means in hospital birth, what are the why do people go mostly? Why do people go to hospitals for birth, especially in rural areas? Okay. One is those women at risk. So in hospital, you see more people who are definitely at risk will definitely come to hospital. Okay. Then age differences might be there, which we didn't know. For example, in home birth, it was a lady who was 25-year-old. In hospital, this lady, another lady was there who was 45-year-old. Just an example. So the chance of death is more there. Okay. Now, general health is bad. For example, in hospital, imagine the lady was diabetic. At home, it was not diabetic. So the chances, or hypertensive more importantly. So in home birth, the lady was not hypertensive. So the chances of death is more. So all these factors are more in hospital, and that could be one reason the hospital death rates is more than the home. Okay, home death rates. Okay, and the difference in age and difference in general health, there is a selection bias. You know what selection bias is. Okay, that is you're selecting wrong people. You're selecting 25-year-old for hospital birth, and you're selecting 45-year-old lady for hospital birth and 25-year-old for home birth, and you're conducting a study. Definitely there is going to be problem. Instead, you have to select, if you're selecting 45 years here, you have to select 45 year also. Then only the study will be proper. That's called selection bias. Okay. So that is, there is no actually association where none actually exists. There is no association in fact. Is there any association now? No, because there is another factors which is influencing the perinatal mortality here, rather than simply taking the hospital birth and home birth. Now let us come on to the second association, which is indirect association. Okay, indirect association, where there is statistical association between a characteristic or a cause. Okay, there is an association between a cause and a disease. Okay, now this is where we are going to come to the point. Due to the presence, okay, of another factor, there is association between A and B because of the presence of a C. Okay, due to the presence of another factor that is known or unknown. Okay, now this is definition, so we'll come to, I'll explain to you what exactly it means. That is common to both characteristic and disease, or cause and disease. Okay, now there is a third factor. Okay, imagine it's a third factor here, and there is a cause and a disease. So this third factor is connected to both of it. Okay, that is what, and the name of that third factor is confounding variable. Okay, you have got a cause variable, a disease variable, and a third variable which is associated with both of it is called a confounding variable. Okay, confounding variable. I'll come to it with an example now. Imagine high altitude. In patients or people with high altitude, you see an association with endemic goiter. That is, people living in high altitude. Okay, what they noticed was there is high chance, or there is high probability of endemic goiter. There were lots of cases coming from high altitude areas with endemic goiter. Later on, they said that there is a third variable which is connected to both of it. That is iodine deficiency, which is the confounding variable. Okay, which is the confounding variable. What does it mean? It means the association between two, that is cause and or a characteristic in a disease, because of the presence of. So what actually the cause here? It is not altitude, it is iodine deficiency. So this is just a characteristic. Okay, so that means association between a characteristic and a disease is due to the presence of a third factor which is associated with both the characteristic and the disease. Okay, so that means what? Iodine deficiency is there in high altitude. Okay, in high altitude there is iodine deficiency, plus also in endemic goiter patients also there is iodine deficiency. That means both are connected. That is, iodine deficiency is connected to both the characteristic and the disease. Okay, let's come to the definition once again. That is a statistical association between a characteristic and a disease due to the presence of another third factor that is known or unknown, that is common to both. Yeah, that's what here. Iodine deficiency is common to both the characteristic and a disease, that is altitude and endemic goiter. Okay, so you go high altitude, you will see that there is iodine deficiency. You check with people with endemic goiter, there is iodine deficiency. Okay, an indirect causation does not necessarily mean, or indirect association does not necessarily mean it's a cause. See, example here, high altitude is not the cause of endemic goiter. If you give in a people with high altitude, if you give them iodized salt, okay, or you supplement iodine, definitely these people will not suffer from endemic goiter. Okay, so high altitude is not the cause is actually iodine deficiency. So an association between high altitude and endemic goiter does not necessarily mean it's a cause. Okay, very important to know. And many direct causal association we're going to see next. Direct means one-to-one relation. Indirect means a third factor. Spurious means actually there is no association. Indirect means there's a third factor. Direct we are going to come see next. Direct, there's no third factor. So many direct association which we saw, which you're going to see, you will see later on further studies were conducted, it was seen that it's an indirect, just to know it. Okay, if you come to research, you'll realize that initially we thought that it's a direct causation is there, but then more studies were conducted. They realized that it's not direct, it's an indirect due to a third factor. Okay. Now, one more example, sugar intake. Sugar intake was seen high in myocardial infarction. So people said there is an association between sugar intake and myocardial infarction. That means more you take sugar, more there's a chance of myocardial infarction. So they said there's a direct association. Then more studies were conducted. They saw that there's a third factor involved, which is associated with both of it, which is cigarette smoking. Okay, cigarette smoking was a confounding variable. That is, the people who smoke cigarette, you will come to them, you see that they have increased intake of tea and coffee. Usually those people who drink coffee or tea, they have more cigarette. Or I would say the people who are more cigarette smokers, that's a better way to explain it. The people who are cigarette smokers usually have cup of tea. So that's the reason they have more sugar intake and not this association. The major association is between these two, cigarette smoking and myocardial infarction. But this association was due to, the sugar intake was due to the cigarette smoking as having or taking more sugar in the form of tea and coffee. Hope you understood. Okay, it's very simple. They saw an association between these two. They said it is associated, no. Then they realized, so they said initially it is direct. Then they said no, so direct means what? This is associated with this. Then they said no, there is a confounding variable, so it's an indirect. Okay. Now there is something known as direct or causal association. Okay, we studied spurious, indirect and direct now. Okay, direct means one-to-one relationship. That is, we've got one-to-one and multifactorial. We'll come to that. Okay, that is two variables A and B. That is, we come into one-to-one. Okay, two variables A and B are said to be causally related or having a direct association if a change in A is associated or followed by change in B. Okay, that means when a factor A is present, disease B is present. When factor A is absent, disease B is absent. For example, HIV/AIDS. Okay, HIV virus. Just an example. HIV virus is present, HIV is present. Or the patient is suffering from AIDS. HIV/AIDS is not present, is not suffering from AIDS. So that is a change in A is followed by change in B. Okay, simple, direct. Okay, now it is related to the Koch's two things. Koch's postulate, we studied Koch's postulate, that is bacteria is always cultivated, that this or not. There are points we've studied in microbiology, so definitely that means a causal relationship, a direct relationship is there when we studied Koch's postulate. Also, the germ theory of disease, that means a germ is there which produces a disease. Always there is a germ to produce a disease. Now, so they can ask you causal relationship is associated with what? Koch's postulate, germ theory, both A and B, none of the above, both A and B. Okay, if in case they ask you this. Now, not always true. It's not always true that if A is there, B will be there. If A is not there, B will not be there. No, it's not always true. I'll come to this. For example, tuberculosis is a typical example. Okay, in tuberculosis, if you see, the tubercle bacilli is not found in all cases of TB. Now, patient is suffering from TB, and when they check for the bacilli, you see that the bacilli is not there. So the mechanism has started in the body, which is causing the disease, inflammation problem, chronic inflammation cases, necrosis, all is going on due to the presence of lymphocytes, macrophages and all, but the bacilli is not there. Okay, we've studied this in detail, isn't it? The mycobacterium. So tubercular bacilli is not found in all cases, if you see. Also, in some cases of tubercular bacilli is present. You see that the bacilli is present. You go for the test, you see the bacilli, but there is no disease. So that means causal association is not always true. Though it is the best way to explain the association, the causal association need not be always true. Okay. Now, sometimes you will see that a single cause may lead to more than one outcome. We studied one cause, one outcome, isn't it? So you will see that in some cases, one cause is causing different disease. Any example you can think of? It's very simple. Hemolytic streptococci producing different diseases. So what are they? Streptococcus tonsillitis, scarlet fever, you know this, erysipelas, all these it causes. The streptococci can cause this. That means you can see that a single cause can lead to more than one disease. So a direct causal association is having a small problem now here. Okay, one cause, multiple disease. Okay, so that is also seen. Okay, so what does it mean here? One-to-one causal can be one-to-one or one-to-multiple disease. One agent, multiple disease. An exception for this case is, so that's what we are studying. So one thing is it's related to Koch's postulate and germ theory, and one exception is tuberculosis. Okay. Now you come across multifactorial causation. So we studied one-to-one, one agent, multiple disease, one agent, one disease, one agent, multiple disease. Now we are going to come across one disease with multiple agents. Okay, here it is one agent, multiple disease. We are going to come across multifactorial causation. Multi-factors are involved. Multiple agents, one disease. Okay, that is, it is seen in non-communicable disease. So in communicable, you will see one-to-one or one-to-multiple disease. Okay, in non-communicable disease and chronic diseases like diabetes, hypertension, myocardial infarction, etc., you will see that this is multifactorial causation, direct causation, where etiology is multifactorial. And you can see here two models in this multifactorial. So what is one-to-one? One agent, one disease, or one agent, multiple disease. Okay, now when you come to these multifactorial, multiple agents, one disease. Okay, multiple agents, one disease. Okay, so there are two models for this multiple agents, one disease. It can be either each factor acting independently. We studied multiple factors are involved. So either it can be each factors acting independently of each other. Okay, we studied multiple factors are there. It can be either independent or all the factors are acting cumulatively to cause a disease. So in the first case, it can independently cause a disease. I'll give the examples. In the second case, it is all acting cumulatively to cause a disease. Now, to produce a disease. And here what we see is synergism. Okay, the same thing. That is what is synergism. Multiple factors acting together to form a disease or to cause a disease is what is synergism. Now, to come to examples, you'll understand it better. Here, we said it's acting independently. That means factor 1 act independently to cause a disease. Factor 2 can act independently to cause a disease. Factor 3 can act independently to cause a disease, but any one can cause a disease. It's not one agent to cause a disease. Okay, either of them can cause a disease, but they act independently. So this all can act independently, reaction at cellular level to cause a disease. Now, what's the example of this? Smoking can cause lung cancer independently, isn't it? Air pollution can cause lung cancer independently. Exposure to the asbestos can cause cancer, lung cancer independently. So all can act independently to cause a disease. Okay, to cause lung cancer. So that what does it mean here? One-to-one means what? One-to-one means smoking causing lung cancer. There is no other factors involved. One causing other. Mostly it is communicable diseases, infections. But here multifactorial means multiple factors are involved. But in the first concept, multiple factors are involved, but they act independently to cause a disease. Okay, so you'll come to the next one, you'll understand it better. That is, all the causal factors cumulatively produce synergism. That is, factor 1 plus factor 2 plus factor 3 all together is causing the disease. Okay, reaction at cellular level now producing the disease. Okay. Now, one non-communicable disease is Candida. So your textbook doesn't say any examples. I'm going to give you an example here. Candida's presence alone cannot cause a disease, isn't it? There is a immune deficiency, not drinking water. So multiple factors are involved together acting, causing a disease. Okay. Here it doesn't need to be together. This alone can cause lung cancer, isn't it? Here it has to act together to produce a disease. Candida albicans alone cannot produce a disease. There should be an immune problem associated in the patient to cause a disease. Okay. So just a quick review on all the types. Spurious means no correlation exists. In fact, hospital birth and home birth. Indirect means there's a third factor involved. And direct means direct. It can be one-to-one, okay, and multifactorial. One-to-one means germ theory and the Koch postulate, and multifactorial means multiple factors involved. It can be acting independently or coherently. So we studied if there is an association, there is a possibility that we can say that there is the cause and the disease is connected, okay, or the cause is related to the disease. Now, there are certain additional criteria for judging the causality, not causality, causality, that is if the cause is related to the disease or not. One is association. Okay, you can connect an association. Now, here additional criteria are there. Now, who brought this? There's a person called Bradford Hill. Okay, he said that the likelihood of causal relationship, the likelihood that is there is a cause is related to the disease, is increased by the presence of the following criteria. What are they? Just know the names. Temporal association. So this is where people confuse. It's not a type of association. It's a criteria where the causal relationship is further implemented or further, strengthened. Okay, so it's temporal association. So there are three types of associations: spurious, indirect, and direct. Then this is temporal association, which is something which strengthens the causal or direct relationship. Okay. Now, second is strength of association. Third is specificity of association, consistency, biological plausibility. Just know the names. Coherence of association. I'll explain the temporal. The other is very easy. Temporal and biological coherence. Okay, separately. So what other means? Strength of association. How strongly they are associated. Okay. How specifically they are associated. Does cigarette smoking only cause lung cancer or does it cause any other disease? Okay, that is how specific it is. Okay, then consistency of association. So you repeat the test again and again. Smoking, you see that smoking is associated with lung cancer. Again, you see smoking is associated with lung cancer. That is consistency. Then biological plausibility and coherence, I'll tell that separately. That is, all this criteria best explained by the association between cigarette smoking and lung cancer. So we'll come to the first one, which is temporal association. We'll see. Now the question here to be asked, to answer if there is a temporal association or not, is that does the suspected cause precedes the observed effect? Now we studied the typical example is cigarette smoking and lung cancer. So does cigarette smoking occurred, or did the cigarette smoking occurred before lung cancer or after lung cancer? Was he smoking after the lung cancer or was he smoking before he occurred the lung cancer? If you see that there is this cigarette smoking is seen there first and then you see the lung cancer, that means there is a temporal association. You say that there is a temporal association. That is, a causal association requires the exposure to be preceding the onset of disease. The exposure should occur first, then only disease. If that is happening, we will say that there is a temporal association. Example is smoking lead to lung cancer, but how long? 30 years. Okay, the patient started, usually you see that this is what 30 years of smoking, usually we have seen that it caused lung cancer. So the patient has started smoking 30 years back. Okay, that has caused the lung cancer. That's called a temporal association. This is a term which you have to know, and you have to separate it from the types of association. Temporal association is not the type of association. Okay, they'll ask you all of the following are types of associations except the direct, or I would say spurious, indirect, and direct temporal. Temporal is not a type. That's a criteria. Now again, they can confuse you. Or someone who putting the question really want to confuse you. All of the following are types of association, or all of the following are associations except. There you give direct, indirect, temporal, and one I would say factorial, simply just an example, factorial association. In that you have to select the best answer. Factorial is nowhere there. There is no association called a factorial. So in that case you might select the temporal association. This is what you call the best answer. Students ask, so if this is the answer, if like I could see that in the textbook, this is also given and the answer is this. The question is, what is the best answer? Okay, what is the select the best correct option? So in that case, you might have to select temporal association. But if they give you the first three and this one is the fourth one, this is the best answer. Okay. Now I told you I'll explain to you biological plausibility and coherence of association. Biological plausibility means, is there a biological mechanism which can explain the association between the cause and disease? For example, lung cancer and cigarette smoking. Is there a biological mechanism which causes cigarette smoking into cancer? Yes, metaplasia. We studied in general pathology. Cigarette smoking for continuous period can lead to metaplastic changes, then dysplasia, then you get cancer. So there is a biological plausibility, a mechanism, biological mechanism which explains this. Then coherence of association means, is it related to what is the observation you see, the current knowledge you see in the surroundings. For example, coherence of association example is, earlier males used to smoke a lot. So you see that more lung cancer is seen in males. Now if you see, females also equivalently smoke like males. So now you see that in females also the cases has increasing. So that means it's a coherence of association, coherent with what you see. Okay, it is coherence with what you see, or it is associated with what you see in the normal situations. More males are smoking, more male cancers. Okay, male lung cancers. More females are smoking, now the cases are increasing. So this is the two things, strength and everything is very much simple. Strength, specificity, biological plausibility and coherence of association is something which can confuse you, so that's why I explain. And temporal association, remember, it just answers the question, does the cause preceded the effect or not? That's it. Okay, it's not a type of association. So hope you have understood this three types of association. Now when you see the questions in your book and all, you feel like it's really confusing, isn't it? When I studied for this, I thought, what is this? Spurious association, that association, this association. Then when we start reading books and we start understanding things, it was so simple area. Okay, so it's like that. Now you can connect everything. Even if they ask you from outside also, you will be able to connect it. But one thing you have to know is, you know three things very correctly. Okay. Now again, let me come to the test series. And I could see in some batches, not all, some batches, the test series is not taken seriously. And you see, some students think that I'm not doing good now, so I have lost my way, I'm going to stop my preparation. See, it's not, the preparation graph is never going to be like this. Nor it is going to be like this also. It is going to be like this. Okay? You can't never ever, so it is not like this also. It is not the sine wave. It is up, down. More up, more down, maybe down. More up, so overall it goes up, but there will be depressions. Not the psychological depressions I'm talking, the graphical depressions, where you are having some problems in family, problems in personal issues, maybe for problems in learning, not understanding a subject relative to the subject is very difficult, you didn't understand it at all in your BDS days, so if that subject is very boring for you, you don't like that subject, that is causing the problem, or there's too much to learn, or there's something else disturbing you, that can happen. But the moment you think that it's really disturbing you and it's creating problem for you, that's where people lose their way. Bounce back, come back. Okay, I tell the students, now see, this struggle, okay, this struggle what you do now, okay, is the only hindrance, okay, between your government college seat and your current situation. Okay, and without this struggle, it's not easy. It's not possible also. You have to struggle. Don't think that it'll be perfect. Students come and they think that, wow, wonderful, I'm understanding. But all of a sudden everything goes wrong. They say that, no, this is not what I expected. So it's not for me. Please note, I tell the students, the more you struggle, the more chances is there that you're going to be successful. And I also tell the students, see, it's all about 240 questions, isn't it? It's all about 240 questions. You're studying 50,000 questions. For what? For 240 questions only. Okay, and of this 240, I would rather say 200 questions is what you're going to get it at least properly. Okay, then how much is correct depends upon exam person and all, but 40 questions will be absolutely, or I would say at least 20-25 questions will be absolute nonsense, which you have no idea about. 20-25 depends, but doesn't mean that you should be attempting 250. No, you have to attempt 230. I'll tell you, that is a different story. I'll tell you that. Okay, not now. But yes, what is more important, what is more significant is it's a matter of 200 plus questions. And if God wants to give you that seat, okay, hopefully all of you are listening to me are not atheists. Okay, if God wants to give you that seat, He can give you this 200 questions, but He can't give you based on a simply merit. Okay, He can't say you that, He won't say that, oh, ye to bhakt hai, or this is a very loyal person to me and he's very much believer and I'm going to give. No, that's not the case. In entrance preparation, what God is going to see is, are you really working hard? Are you really putting your efforts? Okay, are you struggling? You don't want to see you struggle, but are you putting your efforts or not? Are you worth it? Then He will give you this 200 questions and you will be astonished. You will be shocked to know that you sit in the exam hall, you see certain questions which you see there's something divine in that. You're getting that question or that answer because you never expected, out of when you studied 50,000 questions, certain concepts come to your mind which you never thought it or it never came before. Okay? All of a sudden you tried, you would have studied it definitely, you would have studied somewhere, but all of a sudden something is put into your mind to connect it, like the association thing. So just connect it this way. Okay, there is someone telling you, do it this way. So this is what is divine help. Okay, so take care of your responsibilities. Okay, be a good person. Don't be arrogant or don't create problem for others, or don't take out your frustration on others because you are not able to study, because that's not the way where you get your divine help. Your divine helps will come only if you work really hard, not causing any problems to others as much as possible. Definitely here and there something wrong will happen, no doubt, but minimize it. Okay, minimize it. Definitely when you are in so much of stressful situation, putting all your efforts for the entire year, it's not going to be an ideal person behavior you can't see there. There will be problems, but minimize it. Okay, and try to put your efforts. And more efforts you put, the more you struggle, the more you bounce back, the chances of getting these 200 questions will be very, very, very high. Okay, that's how you get in. Otherwise, just imagine everyone is studying for this, no? Everyone is preparing for NEET, 20,000, 25,000 people. But how is it that 250 people are selected? And of which majority were very average nominal students. How? The effort they took, the struggle they gave, the number of times they bounced back. And God decided, okay, I'm going to give this person a seat. And that is where you sit for the exam. You get 40 seconds for a question. And you see that when you're reading the question in 5, 10, 15 seconds, in the next 5 seconds, something comes into your mind which will connect the answer, which you never thought you will be able to answer it. Okay? So that's very, very important. So I'll stop it here. See you in the next class. Goodbye.